Let's talk about something no one in medicine ever seems to give a straight answer about: urgent care salaries. If you search online, the numbers are all over the place. One site says urgent care doctors make $180,000, another says $320,000. Some claim physician assistants make $90,000, while others put them at $160,000. Nurse practitioner estimates are just as inconsistent. You'll see 110,000 in one place and 180,000 or somewhere else. So what's the real number? In this video, we're breaking down what urgent care clinicians actually make in 2026, including emergency medicine physicians, family medicine doctors, internal medicine doctors, physician assistants, and nurse practitioners. And stay until the end because I'm also going to show you how some urgent care clinicians increase their income by $50,000 to $100,000 per year without changing jobs. Before we get into the numbers, there's a quick note about where these estimates come from. These numbers come from a combination of national compensation reports, job postings across major urgent care systems, and real hourly rates clinicians report working in urgent care today. Because urgent care is largely shift-based, compensation can vary quite a bit depending on location, productivity bonuses, and shift structure. That's why, instead of focusing on one magic number, it makes more sense to look at realistic salary ranges. And if you work in urgent care, I'd actually be curious what the pay looks like in your area, because these numbers really do vary a lot across the country. Let's start with emergency medicine physicians. A lot of emergency medicine doctors work in urgent care, sometimes as part-time, sometimes full-time. And the reason is pretty straightforward: lifestyle. Emergency departments often means overnight shifts, trauma activations, critically ill patients, and unpredictable volume. Urgent care is usually lower acuity and more predictable. No trauma activations, no ICU admissions, no cardiac arrests. And for some ER docs, it offers a very different pace of practice. In 2026, emergency medicine doctors working in urgent care typically earn between $130 and $190 per hour. And this is where urgent care pay gets interesting. Most urgent care shifts are around 10 to 12 hours long, so a typical shift may pay somewhere between $1,300 and $2,200. If an emergency physician works about 14 to 16 shifts per month, annual income often falls between $250,000 and $340,000 per year. Next, family medicine physicians. Family medicine doctors make up a large part of the urgent care workforce. Their training covers adult medicine, pediatrics, acute illness, and minor procedures, which lines up closely with the type of patients seen in urgent care every day. In 2026, family medicine physicians working urgent care typically earn between $115 and $160 per hour. Working about 14 shifts per month, annual income usually falls between $210,000 and $300,000 per year. And depending on the system, productivity bonuses and performance incentives can push those numbers higher. Now, earlier I mentioned that some urgent care clinicians increased their income by $50,000 to $100,000 per year. Later in the video, I'll explain exactly how that happens. It often comes down to things like productivity metrics, operational performance, and shift differentials. But first, let's talk about physician assistants. PAs are extremely common in urgent care. In many centers, the primary clinician on shift may be a physician assistant or a nurse practitioner. In 2026, PAs working urgent care typically earn between $65 to $95 per hour. A full-time urgent care PA usually works around 12 to 14 shifts per month, which typically results in annual income between $120,000 and $175,000 per year. But there's one urgent care pay difference that surprises a lot of clinicians, and we'll get into that in just a minute. Now, let's look at nurse practitioners. NPs also play a major role in urgent care staffing, and their compensation is generally similar to PAs. In 2026, nurse practitioners working urgent care typically earn between $65 and $100 per hour. With a typical urgent care schedule, that usually translates to annual income between $120,000 and $180,000 per year. Many urgent care systems also offer signing bonuses, retention bonuses, and productivity incentives on top of the base pay. Now, let's talk about internal medicine physicians. Internal medicine doctors do work in urgent care, although less commonly than family medicine physicians. The main reason is that internal medicine training focuses primarily on adult medicine, while urgent care often includes a significant pediatric population. That said, in urgent care settings with lower pediatric volume, internal medicine physicians can work very comfortably. Typical compensation for internal medicine physicians in urgent care ranges between $110 and $155 per hour, which generally results in an annual income between $200,000 and $290,000 per year. So how do some clinicians increase their urgent care income by $50,000 to $100,000 per year? Usually, it's not one giant secret. It's a combination of smaller factors that add up. The first is productivity. Many urgent care systems track how many patients a clinician sees per hour. Clinicians who maintain an efficient workflow may qualify for productivity bonuses. The second is total patient volume during the shift. Seeing just 2 or 3 additional patients per hour over the course of a full day can make a real difference. By the end of the shift, that adds up to several more patients overall. And in some systems, that it can increase bonus payouts. The third is operational performance. Many urgent care groups track things like chart closure rates, documentation turnaround time, and patient throughput. Clinicians who close charts quickly and keep the flow moving may qualify for additional incentives. The fourth is patient experience scores. Many systems track Net Promoter Scores, or NPS, as a measure of patient satisfaction. Higher scores can sometimes be tied to bonus structures. The fifth is shift differentials. Many urgent care centers pay more for evening shifts, night shifts, and weekend coverage. Night shifts in particular can carry a noticeably higher hourly rate. The sixth is holiday coverage. Holiday shifts are often some of the highest paying shifts in urgent care. Some clinicians intentionally pick up a few holiday shifts every year because the added compensation can be substantial. And finally, extra shifts. Because urgent care is shift-based, even picking up 2 additional shifts per month can roughly add up to $30,000 to $50,000 per year, depending on the hourly rate, of course. Urgent care has become one of the fastest growing areas in healthcare. There are now more than 15,000 urgent care centers in the U.S. While many urgent care visits look simple on the surface, the real challenge is the clinical decision-making behind them. Fast pace, high volume, limited information. And that's exactly where a lot of clinicians either become very efficient or get burned out fast. This channel is focused on practical frameworks to help clinicians navigate those situations more safely and more confidently. If you found this helpful, consider liking the video and subscribing. And if you work in urgent care, I'd genuinely be curious what compensation looks like in your region.